You know, in the emergency room, life and death are often decided by pretty simple things. Not some fancy new technology, but a basic chemical compound with some incredible power. Today, we're exploring calcium chloride, what I like to call the ER's high stakes specialist.
Okay, so picture the scene. Alarms are blaring, a patient's heart is struggling, and every single second counts. The team needs an immediate, powerful intervention. So who do you call for in that critical moment?
Well, the answer might actually surprise you. Because sometimes the most effective hero in that room isn't a person at all. It's a specific chemical compound drawn up into a syringe.
And that specialist is calcium chloride. Now, it's a name that might sound pretty basic, but I promise you, its role in emergency medicine is anything but. So let's get to know what makes this stuff so indispensable.
At its core, calcium chloride is really just a super concentrated form of an electrolyte our bodies are desperate for. I mean, calcium is like the spark plug for so many of our body's functions. It lets our nerves fire, our muscles move, and most importantly, it's absolutely essential for a normal, strong heartbeat.
Let's talk potency for a second. Calcium chloride is 27.2% elemental calcium. Now that is a massive concentration, making it an incredibly powerful, fast-acting tool. It delivers a huge physiological punch, which is exactly what you need in an emergency, but it's also what makes it so dangerous. So, if it's this potent, you obviously can't just use it for anything. It's reserved for very specific, very dangerous missions. Let's take a look at the exact scenarios where this specialist gets the call.
There are three main approved missions. First, hyperkalemia. That's when there's a dangerously high level of potassium in the blood, which can literally stop the heart. Calcium chloride protects the heart from potassium's toxic effects. Second is hypocalcia, or critically low calcium. And third, a calcium channel blocker overdose, where it helps counteract the toxic effects of that medication.
Now, with great power comes a very strict set of rules. You just can't deploy a tool this strong without an exact protocol. These are the rules of engagement, and they are absolutely non-negotiable. How it's given is absolutely crucial. It has to go directly into a major vein. We're talking intravenously only. If it leaks, it can actually destroy the surrounding tissue. And maybe the most important rule of all is to push it slowly. The max speed is 100 milligrams per minute. We'll see exactly why that speed limit is so critical in just a moment. And this timeline shows you exactly why it's such an important emergency drug. The effects kick in within just 5 to 15 minutes, stabilizing the patient rapidly. And then those life-saving effects can last for up to 4 hours, which buys the medical team critical time to fix the underlying problem. But, as you know, every high-stakes mission carries the risk of collateral damage, and calcium chloride is no exception. The risks here are just as significant as the rewards, which is why handling it requires extreme care. So, just as there are clear go signals, there are absolute no-go scenarios. You never, ever give it to a patient with digitalis toxicity, that's another heart medication, because it can make deadly heart rhythms even worse. And obviously, you don't give it to someone who already has too much calcium, a condition called hyperkalemia. It's all about knowing when to abort the mission. If things go wrong, the side effects are severe. It can cause the heart rate to drop dangerously low, that's bradycardia, or it cause a sudden plunge in blood pressure. Patients often report a strange metallic taste. And like I mentioned, if it leaks out of the vein, it can cause necrosis, literally killing the local tissue. This quote, straight from the clinical protocol, gets right to the heart of the danger. May cause hypotension, bradycardia, or asystole if given rapidly. Asystole, that means cardiac arrest, a flat line. Pushing this drug too fast can literally cause the very thing you're trying to prevent. That's why that 100 milligram per minute speed limit is a life-or-death rule.
It also has some dangerous interactions with other common ER drugs. We already talked about digitalis. With calcium channel blockers, it can cancel out their intended effect. And with sodium bicarbonate, it's a pure chemistry problem. The two will literally react inside the IV tubing and form a chalky solid that clogs up the whole line. You have to flush the line between giving these drugs.
So, after looking at the missions, the protocols, and the dangers, what's the final analysis? What's the key takeaway from this deep dive into calcium chloride?
Well, the crucial point is this. Calcium chloride is a specialist, not a generalist. It is a powerful, high-risk, high reward tool that is reserved only for specific life-threatening emergencies where the potential benefit clearly outweighs those profound risks. It really is the definition of a double-edged sword.
And that leaves us with a final thought. The fact that a simple salt solution, if it's administered just a little too quickly or in the wrong situation, can stop a heart, it really makes you think. It's a stark reminder of just how incredibly fragile the chemical balance inside our own bodies truly is.